Dr. Joel Klein, and he is the newest member of Ventana Wellness, and he joins me today. We're going to be talking about a subject that you're more than welcome to email us or give us a call. The phone number is 541-776-5368. We're going to be talking about food allergies. And Dr. Klein, welcome, and welcome
Thanks.
to Medford.
Thank you.
From Colorado Springs.
Right.
Well,
Just settling in.
That's okay. You're over here where God bought his retirement home.
Yes, I've noticed the number of golf courses.
Yeah, well, there you go. There's a lot of them here. Are you a golfer?
No, I'm not.
Well, good.
Actually.
Are you a fisherman?
No, I'm a hiker and biker.
Hiker and biker. Well, we have some converting to do. Jerry, one of our guys here, he's a salmon fisherman. He'll get you hooked. Hey, thanks for being with us. This is an incredible topic. You know, interestingly enough, my wife and I were driving to church yesterday, and she made the comment. She says, you know, I think I need to go get tested for allergies. And I said, well, let's get it done. And so there are several kinds of allergies. There's the food allergy and the plant allergies, right?
Well, yes, there's actually, the mechanisms are different, and this is where it gets tricky. The normal allergy mechanism is by histamine. Everybody knows we take antihistamines for what the allergist will test you for.
Yeah.
Ones that are causing even bigger problems for people are these delayed allergies. I learned about them 30-some years ago, that cause inflammation. And inflammation's at the root of pretty much all chronic diseases at this point. So this is a more hidden type of allergy that people may not be aware of as immediately.
Really? So how do you get tested for this?
Well, that's tricky also. You have to have a doctor who knows to suspect them, and usually in any inflammation issue, we do. The easiest way is actually to stop the foods, and there are some really common ones that cause the problem. There are some allergists who will test for it. I only know of one in Denver. I haven't gotten to know the local community yet, but that would actually have you call the next day to see if your allergy testing on your skin had gotten larger. There's also some blood tests that some labs will do, but they're very expensive. So the easiest way is to actually stop the food and see if your symptoms get better.
So you take segments of food, like get rid of dairy products for a day?
Dairy, well, actually, it usually takes a few weeks or longer, or a month. Wheat is probably the biggest one. Gluten, and many people are becoming aware that gluten is far more of a problem than doctors had thought, and this is medically documented now.
I'm amazed by the whole gluten thing.
This is, researchers at my medical school actually published an article where they found that even in the blood testing, 1 in 133 people have celiac disease.
Wow, wow. All right, let me just say to our viewers and listeners, you're welcome to call and talk to Dr. Klein. Our phone number is 776-5368. And if you want to talk about food allergies and these kinds of things and inflammation, give us a buzz. Take advantage. You don't have to pay for this appointment.
Right.
776-5368. All right, so what are some of the most common food allergies, Dr. Klein?
Again, wheat, gluten. Gluten is a protein, so other grains that contain gluten are like barley, rye, even spelt that you get in the health food store. Oats can get contaminated with it. Dairy, high on the list, especially with children. Any children with asthma, chronic ear infections, these types of things, chronic tonsillitis, dairy is frequently a big problem. And corn and soy are big on the list. And interesting, these are all the foods that our government subsidizes so that people are eating all the time.
Wow. All right, so let's go back to gluten just for a moment. How does it show up as a problem? Where do you begin to sense it?
Well, frequently it can be with gastrointestinal problems. People will notice that they have irritable bowel syndrome is a lot of times a gluten problem, other chronic gastrointestinal complaints of cramping or the like, but sometimes it's just by suspicion of the condition. So it can be anything from asthma, eczema, migraines, menstrual problems in women and menstrual cramping, arthritis. Any of these can be related to a hidden gluten allergy.
Wow. So when you suspect that in a patient, so what do you have them start doing?
I give them very specific instructions on how to do a gluten-free diet, and usually within a few weeks, you can tell if there's a difference, although some more serious underlying diseases, things like rheumatoid arthritis or these more serious inflammatory problems, sometimes it can take a few months.
Okay. Let's go to dairy products for a moment, because I've read a lot that people are allergic to dairy products.
Right.
It's a big issue.
Big issue.
Yeah.
Now, if you talk to the people in India who've been doing this for thousands of years, they will say it's because of what we do to the milk. That if you would just drink it out of the cow and boil it with some digestive spices for a few minutes, we wouldn't have the problem. But after you pasteurize it, the proteins break apart and become much more prone to causing allergy. And it's usually cow dairy. It's the casein protein in cow dairy that's the problem. Whey protein usually is not a problem for people. So things like sheep milk, goat milk actually can be well tolerated by people with a cow dairy allergy.
Really? All right, so do you just take them off all dairy products?
That's the best. It's also the most challenging.
All right, so that's like milk, cheese, ice cream.
Butter, all of it.
And ice cream? We have to
and ice cream,
and
I know,
ice cream.
even when it's 100 and whatever outside.
And ice cream, I mean, today's National Root Beer
But
Day.
you can get Coke in the health food stores. You can get ice cream made from coconut milk.
Yeah.
And it's wonderful.
Yeah. So how does that show up? How does a dairy intolerance show up in people?
Frequently the same ways, although more commonly it's respiratory problems, a chronic cough, chronic sinusitis. And again, in children, we see it even more with the chronic ear infections and those things. I notice if I take some cow dairy,
Oh, really?
after, yep. Yeah, so I can only do a little bit. I like my ice cream too, when it's 100 degrees outside, but a lot of times it will just be that.
All right, so just you can try it for a couple of weeks without taking it, obviously, and that's the best way to test it.
Now, with children, that can be challenging. People will say, well, you can try to do the best you can, and sometimes just decreasing it maybe by 50% might be enough. The best, the most efficient way to do it is to get rid of it completely, watch if the symptoms go away, and if they do, then reintroduce the food. And if the symptoms come right back, you have your answer.
All right. Let me just say to our viewers and listeners again, you're more than welcome to talk to Dr. Klein. He's with us for the rest of the program here today. And the phone number is 776-5368. Hi, Bob. You're on the air with Dr. Klein. What's your question today?
Oh, thank you. Dr. Klein, my question has to do with any connection with allergies and multiple sclerosis.
Yes.
Is there a particular connection or
there
whatever between those?
Yes, thanks, Bob. There certainly can be. All of the autoimmune diseases, and multiple sclerosis is one of them, can be caused or at least contributed to by these hidden food allergies. And with MS, there was something called the swank diet that seemed to work for people as an adjunct to their therapy, and that was getting rid of all 4 of those foods. It's basically eating protein, fruits, vegetables, nuts, and seeds.
Wow.
What's been called the caveman diet.
Now, when you put somebody on a diet, do you graduate them down or you just say cold turkey?
I leave them the option. I don't give orders to people. I give suggestions. I tell them.
But you're the doctor. They're going to do what you tell you.
No, that's, people are responsible and they have their own lives. And I think that they're the ones that know what's in their life. So I'll say the best thing, the most efficient way to find out is to get rid of it completely. Then you will know but if they find that too hard to do, I says, well, do the best you can. We'll see if it works. If it doesn't, we won't know, is it because you needed to get rid of it completely or we're barking up the wrong tree and you really need to do it completely. I recommend they do it completely if they can.
All right. I just a little off topic, but maybe it's not. And that is, I become really quite scared that cancer is epidemic. It just seems to be epidemic.
Right.
We're not saying it is, but it seems to be.
Well, the World Health Organization estimates it will pass heart disease as the #1 cause of death in the world.
I'm just amazed by it in the different forms and all of the varieties and all of that. Is there a link between processed foods and cancer?
I think there is, it's a pie diagram. There are many causes that are contributing. I think that, but a diet that promotes inflammation will absolutely contribute to cancer because chronic inflammation is at the root of a lot of cancers as well. I don't think by itself it will, but you combine it with high sugar diets and environmental toxins and stress hormones and all these other things, and then you have a perfect storm for cancer to develop.
All right, so how do you manage protein when you're putting somebody on a diet like this? Isn't protein a necessity in all of this?
Protein is, but you can also eat too much of it. I actually focus not so much on the protein. I mean, if people can afford to get hormone-free, antibiotic-free protein products, that I think is advantageous. I focus more on the processed carbohydrates. All the flour products are much more of a problem. All the bread, pasta, crackers, chips, cookies, cereal, tortillas, those are a much bigger problem to me, and I want to work with people in getting rid of those as much as possible.
Well, there you go, folks.
Unfortunately, our entire economy runs on those products.
Well, but you know, it can be done. I mean,
absolutely, it can be done.
Nish has been on this program for years, singing that song, and people gradually, you know, there's an old saying, there's only two things that make you change, inspiration or desperation.
Right.
So sooner or later, something pops up in your life, and you're going to take action.
And usually God taps on your shoulder at the right time and gives you a hint. Now, sometimes we're not as good at listening to those hints, but says, it's time to change.
Time to change. All right. Now, what about supplements during this time?
You know, supplements are helpful. Although I have an analogy, I tell people it's like you're in a canoe and supplements are your paddle. But how you live and how you eat are the river. If the river's not going in the right direction, you can take all the supplements you want. You're not getting anywhere.
Yeah.
You get the river going in the right direction with diet and lifestyle, you don't need a big paddle. You don't have to take a lot of supplements. You just need a little, or maybe to just guide you downstream. So I'm not big on people taking a lot of supplements.
Wow. All right. We'll get into that too. And by the way, if you want to talk to Dr. Klein, the phone number is 776-5368. Hi, Sue. What's on your mind?
I have a question about sugar. I know sugar is probably top of there. It's always the top of all the bad lists of what you should stay away from. And I'm wondering about the fructose in fruit, if that is an issue or not.
It certainly can be if people are eating too much. And this is why high fructose corn syrup may be a problem. Large doses of fructose induce a low-grade diabetes. And if you think about it, when we lived more by natural cycles, we ate those fruits in the late summer and in the fall when we were fattening up for the winter. We didn't eat them all year long because we were made to, it induces a low-grade insulin resistance. And so, yes, that's why I tell people that 7 servings of fruits and vegetables, Americans think that means 6 fruits and 1 vegetable. And I tell them, I think you should try to flip that to the other way, to 6 and 1, 5 and 2 in favor of the vegetables.
Okay, so maybe 2 servings of fruit a day would be...
Yes, here in the midsummer, sure. You know, you want to do the fresh fruit, but people stuff bananas and all these berries. You know, berries are better than the other larger fruits and the citrus fruits. But people stuff all these things into smoothies, think they're doing something healthy, and they're actually still probably overdoing it. Although for most people who don't have chronic medical problems, they can probably get away with it. But if you have any sort of issue, it's probably best to minimize it.
Okay, and what about constipation? Could a poor diet, you know, I mean, we eat pretty healthy, my husband and I, but we do eat grains and all that kind of stuff, and we're trying this now, what you're talking about, we're trying it. This is day 3 of taking away our happiness, but I'm wondering if constipation, you know, could be aided by just eating the meat, veggies, fruits.
Absolutely. The toxicology people have a saying that says the solution to pollution is dilution. If you want to clean a bathtub with dirty water, the best thing is just, you know, for the body. I mean, yes, you can empty the whole thing, but that's a big stress on the body. Just put clean water in, and eventually the toxins will be diluted. I'm also not an advocate of aggressive detoxes. I think people get sick with those, and in the ancient schools that looked at this in India and China, you did a bad job. You botched it if somebody had a detox reaction. So I'm more in favor of just putting the good stuff in. However, there's a saying from the Ayurvedic physicians in India that if you're unhappy, the most healthy diet will still get turned into toxins. So I think it's more important to be happy than eating the right diet.
Let me go to the phone right now, Dr. Klein, because I do have a question that came up in the news this morning, and I'm going to ask you about that a little bit later on. But Dee, what's your question this morning?
Hi. I'm wondering, I'm in my 50s, and my mother had arthritis in her hands as she got older, and I'm noticing as I'm waking up that my hands hurt, but they're not swollen, and I'm thinking, okay, they're going to do that next. What can I do to prevent that?
The easiest thing, well, the easiest I say, the simplest thing is to try you'll know in 3 to 4 weeks. If you want to try 1 food at a time because it's not so stressful, I would start with gluten. You can go to celiac.com, C-E-L-I-A-C. That's the website for people with celiac disease, which is the gluten intolerance. You can find all kinds of tips on how to eliminate gluten. For an adult, I would next start with corn. Corn is very common, and then maybe dairy and soy, but I would certainly start with the gluten if you can do the corn at the same time. And if those are a problem causing your inflammation, like I say, you'll know in a few weeks.
Okay?
All right, thank you.
All right, thank you,
Sure.
Dee. All right, 776-5368. I'm going to go off topic just for a moment. We had a topic this morning that came up that said some things that men need. Women, I guess, need calcium.
Everybody needs calcium, but it's overrated.
Really?
Yes, we don't need nearly as much, according to studies that have come out of England and all that. We don't need the 1,000 to 1,500 milligrams a day, and it's actually should be balanced with magnesium.
Okay.
Which you get from leafy greens,
Yeah.
those vegetable things. If you're going to take a supplement, though, it should be balanced calcium and magnesium.
Okay. And as a kidney stone sufferer, I found that out the hard way.
I've had two.
Yeah, I found that out the hard way. I cannot take calcium without magnesium, and the two. Anyway, the other one, for men, it was boron. Is that true? Men need boron? Is that a form of testosterone? Or
No. I haven't seen, I may have to look that one up again. I find that micromanaging nutrients is not as, again, God didn't build us that way. He built us to eat real food.
Yeah.
I haven't heard, I know that boron is very helpful with women and bone health and osteoporosis.
Okay.
As being part of all of that. But I don't favor going cherry picking and going to all the little
It was just,
there.
we made fun of it all morning.
I mean, if we eat real food, we will get everything that we're supposed to
Are
have.
you high on organic food?
I am, but again, not at the point of stressing out about it for your budget. I think that the organic vegetables, because when plants are stressed, and we're seeing this with the drought throughout the country, they make more of these valuable compounds. So I do it myself. I advocate it, but I recommend that people do the best they can, because again, if you're stressing over buying it because it's more expensive, that's not helping you either.
All right, because you're saying some other things here. You're saying be happy. Faith plays a major part of all of this.
Probably the biggest part.
Okay. I just read an article sitting on a plane when I missed all these flights. Things of longevity, healthy eating, obviously, and everything you're talking about today. Faith was a huge part of it. Selecting friends that you can be comfortable around. If they stress you out, go into another room.
Right.
And moderate exercise and lots of water.
Yeah.
I mean
stress hormones accelerate the aging process and also decrease your digestive ability. We could do a whole other show on everything that stress and stress hormones
I want to do
and
it.
what they do to the diet, and promote a more acidic environment in the body, which promotes inflammation.
I want to do that. All right. Hi, Peggy. You're on the air with Dr. Klein. What's your question today?
Oh, hi. I believe I have an allergy because, but I don't know to what. I know I'm allergic to sugar. I've been tested for that, cane sugar, and also baker's yeast. Anyway, I tend to have like hives or itchy things, like knots on my head, the hair, like the hair follicle areas. So I was wondering how normal is that to
It's not, and I suspect you have a yeast issue. Have you had a lot of antibiotics through your life?
Not really.
Not really?
Not a whole lot. No.
It sounds like you could have an overgrowth of yeast in the intestinal tract, and people with yeast in the intestinal tract, like this doctor in Denver, they wind up allergic to everything.
Candida.
It's a candida problem, and when he won't even test people for food allergies if he thinks they have a yeast problem, because they just light up for everything and then wind up treating the yeast. But again, the same culprits wind up being involved, and if you're going to start with food allergy, I would start with gluten, because that seems to be fairly universal in people with candida problem.
Okay.
Oh, okay.
Thank you,
Sure.
Peggy. All right, John. Hi, John. You're up with Dr. Klein. What's your question today?
Well, it's so interesting. There was a feature on 60 Minutes last night about sugar.
Yes, it was a rebroadcast.
Yeah, wasn't that interesting?
Yes.
Pretty much they said it was a poison to the body. Heart disease, diabetes, has an addictive quality to it.
Right.
I'm just wondering, doctor, have we made sugar the modern-day golden calf?
Absolutely. What are we doing with sugar? We're trying to fill a vessel with sugar that should be filled with joy and love. We don't have it, so we reach for the sugar. And I forget who the quote is from, but the dose determines the poison. Anything can be toxic. You can drown from too much water. So, but sugar, the average American consumes 160 pounds of sugar a year. And since I'm not doing hardly any, I know that means some people are doing a whole lot more, and that is absolutely a modern day golden calf. We're reaching for that to fill the void inside of us that needs to be filled in other ways.
Wow. Well said. Thank you, John. I want to come back to that. But Dick, you're up. Go ahead.
Yeah, could you make the connection, please, between chronic allergy and heart disease, primarily atherosclerotic plaque, that type of thing? Is there a direct connection with that?
Yes, because atherosclerosis is an inflammatory problem. It's not caused by high cholesterol, and don't get me started on that one. You may want to do a whole show on that one.
I do.
Oh boy. But Dr. Paul Ridker at Harvard has shown conclusively that the inflammation is at the root of cardiovascular disease and atherosclerosis. And again, we're talking at one more inflammatory manifestation of diet, food allergies, and excess processed foods.
Thank you.
All right. Thank you, Dick. Hi, Susan. You're up. Go ahead.
Hi, Dr. Klein. Welcome to Medford. We're really glad you're here. I'm one of your first patients next month.
Oh, good.
I do have a question, though, what your take is on H. pylori, if it is an inflammation, infection, allergy, or do they all pull together, and what your treatment is for it.
That's a little different. The H. pylori, for people who don't know, is the bacteria that has been touted as the cause of ulcer disease. Mm-hmm. I will remind people who don't know, Louis Pasteur, the father of modern microbiology, said 120 years ago that it was the host, not the bug, that is the problem. Why is the host creating a hospitable environment for the bug? So this is an infection, but again, why is the body not fighting off the H. pylori? Usually has to do with inadequate stomach mucus protection. Food allergies can play a role because the stomach lining is inflamed and again, not able to kill off the bacteria. So I have more naturopathic ways that I will try first to kill H. pylori. Sometimes you really need to go to the triple drug therapy that conventional doctors use with antibiotics and the proton pump inhibitors. If that's necessary, we make sure that people are on very high dose probiotics to replace the good bacteria in their gut that the antibiotics are killing off.
Wonderful. What about mastic gum? Do you use that?
Yes, that's one of the agents. I actually use a supplement from a company that has a number of different agents in it at the same time, so you don't have to cherry pick, and mastic gum is one of those.
Wonderful.
All right, thanks.
Well, we're excited to have you.
Great, thanks.
Thank you.
Dr. Klein, he's the newest member there and staff member there at Ventana Wellness and new to the Valley, and today talking about food allergies. All right, Sue, we got another Sue. What's your question?
Okay, I'm the same Sue as before, and I also have an appointment with you on your first week here. So I have zillions more questions, but my question today is very simple. I just want to know agave, good or bad?
Horrible.
I knew it. Okay.
It chemically analyze it. It has a higher fructose concentration than high fructose corn syrup.
See, and so the coconut ice cream has agave in it.
I'm sorry?
The coconut ice cream you mentioned earlier has agave in it.
Not all of them. So you may have to.
Okay.
Sometimes they actually use cane sugar.
Okay.
So one more time, you got to read those labels.
Right. Okay. Thank you.
So you give it a thumbs down.
Oh, big thumbs down.
Wow. So what do we do for sugar supplements?
My favorite is xylitol, which is a sugar alcohol. It's metabolized differently. You can get it in the health food stores. Originally extracted from birch trees by the Finns during World War II when they couldn't get sugar. It's not metabolized the same, and it actually helps kill bad bacteria and has been shown to decrease cavities because it also kills the bacteria in the mouth.
We only got about a minute and a half, and I know I'm going to ask too big of a question, but diabetes is on the rise. Is that primarily because of the sugar addiction?
It's the processed carbohydrates, the sugar addiction, all combined, yes. And the CDC estimates that by 2050, a third of this country will be diabetic.
And that's all preventable?
It's 100% treatable and preventable.
All right, and as you get into, what are the stages?
It's not stages, it's types.
Oh, types,
So
okay.
yeah, the type 1 is the childhood kind when they can't produce any insulin at all. They think it's a viral autoimmune process. Type 2 is what we're talking about, which is the adult onset. Of course, now we have 16-year-olds with it, so they stopped calling it that.
Okay, and that can be reversed?
That can be, in my opinion, and my experience in practice, 100% reversed.
All right, and that's through diet? And
through diet specifically, and some supplement help, but mostly diet.
All right, so if you were to, I guess today what I'm hearing you say, of course, you need to go to you and get analyzed and taken looked at, but if we just start cutting down on anything that's white, spit it out?
That's many of the alternative doctors, get rid of the whites.
Get rid of the whites, huh?
Yeah. And including white potatoes.
White potatoes.
That's just like eating sugar.
Okay, and white breads, obviously, and all
White
of
bread, white rice, yeah.
Will you come back? You're a hoot.
Absolutely.
And welcome to the Valley. When do you start?
My first day is the day after Labor Day, September 4th.
All right, so you're still getting your foot on the ground.
Right, yeah, we're just getting settled in here, and I'm taking the opportunity to explore all the lakes and
I
trails.
want to talk to you about cholesterol. You seem to light up about that.
Oh my goodness! I have an hour-and-a-half PowerPoint presentation.
All right, we're going to get some of it. See if we can. Hey, thank you, Doctor.
You bet. Thank you,
Dr. Joel Klein with us today, and again, check him out at Ventana Wellness. You can go online, and then he'll be online there for appointments starting the 1st of September.